Hey guys, Curtis Alexander. Let's talk about PRP versus stem cells in this video. Now, PRP, very popular. It's platelet rich plasma. Basically, what they're doing, they take a blood draw, get 1 or 2 ounces of blood from you, they spin it down, and they get this middle layer. It's platelet rich plasma. It contains the platelets, it also contains some growth factors. I'll talk more about that in a second. Where the problems start to arise is the industry in general likes to say that PRP is a stem cell therapy, and people get confused. PRP is not stem cells. PRP, in theory, may be able to activate some stem cells in your body, in theory, but it is not a stem cell therapy. Okay, that's the first point of contention. That's the way some people sell it in the industry, and it's not true. Now, as far as stem cells, I'm just going broad overview here. I'm not going to talk about any specific types. There's a number of different types. So when we say stem cells, please keep that in mind. I want to keep this video fairly short and just give you a basic overview of the pros and cons of both as a general. Okay. So as far as PRP, are there pros to doing it? It would be the right choice for certain people. For example, if money is a huge issue, they are less expensive up front. But what you find is most people, when they do PRP, it doesn't last as long. So depending on their particular issue, they're going to have to get multiple therapies. So it ends up being less up front, but more down the road. It can provide fairly quick relief for people. Again, it depends on the injury, it depends on what you're going for. Now, as far as the cons of PRP, we already talked about the fact most people require frequent therapies, which can be a pain. Um, it's touted that, oh, PRP is easier. That's actually not true. PRP can actually take longer and be more obtrusive than certain types of stem cells. Now, versus other types of stem cells, it can be easier. I already talked about it. It's actually can end up being more money in the long run, depending again on what you're going after, what you're treating. But if you're doing multiple therapies, PRP adds up over time. People will banter around that, oh, PRP is regenerative. Again, they're going after that avenue where they're saying, well, PRP has growth factors and it can activate stem cells, but it's a very minuscule effect compared to actually giving somebody stem cells. So I think that's kind of unfair. Now, as far as the stem cell pros, again, we're talking broad brushstroke here. I'm not talking about any particular type. Stem cells provide you with multiple mechanisms of action. They're anti-inflammatory, they're antiviral, they're antibacterial, they're regenerative, they're signaling cells. So there's many more benefits than you're going to get from PRP alone. They are more powerful. They do last longer. You're not going to require monthly PRP injections. Now, as far as the cons of stem cells, they are going to be more money up front. But again, if you have to do PRP on a regular basis, that's eventually going to catch up and eventually surpass stem cell costs. And I will say the cons of stem cells, it's really going to vary depending on the type that you use and the results that you could potentially get. Make sure to go to the link in the description if you want to find out the particular type of stem cell I use in my own wellness protocol. My point in doing these videos isn't to push any particular thing. It's just to provide you with basic information. But if you want to know what I use, I talk about it in my email list, which you can get at the link in the description. So let me know if you've used PRP in the comments. Was it helpful? Did you have to get multiple therapies? I'd love to hear your experience. Helpful for me, helpful for other people that watch the video, guys. So I appreciate it. I'll see you in the next one. Thank you.